evening. You're with the Urban Debate with us this evening. Thank you for being with us. I'm Sahar Zaman. Making a start in keeping the COVID-19 focus here, but this is on something that could bring about a change in understanding how we scrutinize COVID data to further help us in our COVID control efforts. This is something that could change, with several experts now indicating that as far as the seroprevalence percentage is concerned, that becomes a far more important indicator of the spread of the infection and not exactly to be dependent on the official recorded figures per day that come in from states. Remember, we are more than 1 year into the pandemic. It has been more than 1 year of people having been infected, people having recovered, people having natural antibodies, people having been vaccinated and jabbed already. So things are continuously dynamic and changing on ground as far as the spread of the COVID infection is concerned. So should we right now be also scrutinizing our data differently? Should the yardstick change is what we're trying to find out here. Now, basis the 4th National Sero Survey that was released by the Government of India, it was the seroprevalence percentage versus cases that are being officially recorded, cases that are being officially reported here, and then with those two figures also getting a sense of managing to calculate to what extent states are actually underreporting. Now, this underreporting could be accidental, or this underreporting could be for various reasons. We're not going to be going into that, but the important factor here is that a seroprevalence percentage versus daily reportage of cases gives us a fair idea of the figure of underreportage of cases that is coming in. If we go for the example of Kerala, because Kerala is continuously now in the headlines, past 5 days it has been recording more than an average of 20,000 cases per day. And the understanding is that if the entire country has an average of 45,000 cases per day, so Kerala holds the chunk of 50% of those cases here. But is that true then? If we look at the seroprevalence percentage, now Kerala has 44.4% in seroprevalence. Therefore, it does have a very high number of cases, but which also means, interestingly here, that Kerala is the lowest as far as underreporting is concerned, barely 6. So Kerala has one of the most transparent reportage of per daily cases here. If we compare this to the example of other states such as Uttar Pradesh or Bihar, which have reported a seroprevalence of 71% and 75% respectively, daily cases reported from these two states are barely in the single digit or the double digit here. But these states also have the highest underreported cases, at least 100 to 134. So does this mean, if central government teams are being rushed to Kerala, does this mean that there needs to be attention in other states as well? States which are not reporting a high number of cases but could still have high infections which aren't being reported. Let's throw this open to our guests. We're trying to clear up the technicalities for you to help you understand how COVID control could be done more sophisticatedly, or does it need a change? Let's throw this open to our panelists here. We have Dr. Sebastian Paul, who's the former member of the Lok Sabha of the CPIM, connected with us. We have Mr. A. Saravanan, who's the spokesperson of the DMK from Tamil Nadu, and Dr. Rajib Dasgupta, who's the chairperson of the Center of Social Medicine and Community Health, JNU, and member of the National COVID Task Force. Good evening, gentlemen. Thank you all for being with us here. First to you, Dr. Paul, because Kerala that continues to be in the headlines here. This is, of course, on a very worrisome note. But this has also largely been the Kerala government's argument that you have been, at the end of the day, extremely transparent with your data. And this is what the comparison of the seroprevalence percentage vis-a-vis the daily reported cases also show, that Kerala actually has the lowest underreportage of just about 6.
It is a credit to the state of Kerala that underreporting is less here. The spread of COVID at such a level is a national issue, a national problem. All have to join hands unitedly to fight this pandemic. But Kerala for the last few days is topping the list with accounting 50% of the inflictions all over throughout the country. We are trying our best. Last year, our record was good and we received acclaim from abroad, foreign countries. But this year, things seem to be going out of control. The COVID is spreading like anything, but we are not in a despair mood. We are trying to control the situation. Now a high-level central team is in Kerala inspecting the situation. We are waiting for their recommendations and advice. So also we ourselves are also trying to evolve a more effective containment plan, because local only two things can be done here to tackle the situation. One thing is lockdown, and the other thing is vaccination. For vaccination, we have to get sufficient number of vaccine from the union government, from the center. As far as lockdown is concerned,
Right.
it is a problem. How long can we ask the people, entire people, to remain indoors? Life is important, so also livelihood. So we are in a dilemma. We are trying to evolve a new plan, a new containment plan. Our chief secretary is doing that work, and we are expecting the reports and from the central team. So I hope let us fight together. It is a national concern, national disaster. Let us fight together, and
Absolutely.
it is not something unique
Right.
for Kerala. That is the
And should there be a new contingency plan in place as well in scrutinizing figures differently? Saravanan, would you like to step in here on this? I'm specifically asking here now, of course, the central government has sent in a separate request to all states individually that even though they've released the figures nationally basis the national survey, the fourth national Sero survey which was done, central government now has asked states to do that independently as well. But Tamil Nadu has done it already, there is a slight disparity. The state Sero prevalence shows about 66.2%, whereas the one that was done nationally shows 69%. So there's a difference of a 3% here. So do you think this disparity can be problematic if we're looking at increasing our dependency on understanding of COVID spread only through a Sero prevalence percentage? Do you think these disparities can be a problem in that process then?
See, I don't think this Sero prevalence difference, the study which has taken place by the central government and the state government, that is difference, it's not going to make any difference the way whether the union government or the state government is going to plan to avert or successfully prevent a third wave. Sero prevalence, it's not done on the actual population, it's just the sample and it is extrapolated to the numbers. So we are not yet very sure whether we should go by this Sero prevalence. If we go by this Sero prevalence study model, then the whole of India has herd immunity. So can we keep quiet based on that? So there is not yet strong scientific evidence on that. But when it comes to how we are going to prevent the third wave, I think there is a slight increase in numbers in the state of Tamil Nadu, and we are worried about it. The state government has immediately stepped in, and we have ordered closure of places where there are large congregation of people, and we have also ensured that the relaxations that are given are only to preserve the livelihoods. There is no other reason. We are making public calls for the people to remain indoors. And yet another aspect, an important aspect, which we missed out during the first wave, onset of the first wave, is genome sequencing. If we had done that in January, if the union government had done that in January and identified the virulence of the strain, I don't think we would have faced such a devastating second wave. Now, the Tamil Nadu government especially had set up, is on the process of setting up a genome sequencing lab in Tamil Nadu itself, so that if the variant is going to be different from this Delta variant, or what kind of damage it can do. So we are onto that. And the union government, I think that is one of it, because on the vaccination front, we are definitely lagging. There is shortage of vaccine. We are not able to vaccinate people who are willing to take vaccines. And everybody knows that until you vaccinate everybody, there is no escaping the numbers of COVID patients. So the other choice is to ensure the genome sequencing and finding out whether the variant that is spreading is the same or it is still more dangerous than the Delta
Okay.
variant. I think
All right.
if the union government does that, we'll be better off entering
Okay,
into the
so
third
your
wave.
learnings, as you say, from the second wave is an added importance to genome sequencing here.
Absolutely.
But Dr. Rajib
Absolutely.
Dasgupta, listening into voices that have come in from Kerala and Tamil Nadu, we're of course not getting into the politics of this here at all, but essentially in a larger understanding of how governments in power in respective states are going to be changing their contingency plans, going to be changing their understanding basis data that is scrutinized differently. Do you think that we're at the cusp of bringing about that change? Can a seroprevalence really be all that dependent as an absolute figure? Because it's also still a percentage that we're dealing with, but it still brings us closer to knowing how much of underreporting is happening.
Thank you. On a lighter note, I am the odd man out here, the non-politician here. But I'm glad there are two politicians who will be able to hopefully translate what I would like to draw the attention upon to their respective governments.
Sure, sir. Sure.
So, thank you. So, on a more serious note,
Okay.
Tamil Nadu, Karnataka, Kerala, and Maharashtra. These are four states which, in fact, we now see are contributing most of the cases, other than the few northeastern states, whose contribution is relatively small, obviously, because their numbers are smaller. These are states which have had the least undercount, which is seroprevalence versus actual cases detected. So in terms of undercount, these states range from 6 to 20. Right. Whereas the large North and Central Indian states range even up to almost 100. That's the extent of undercount in the large states and how little they're here. Now, the fact that seroprevalence is relatively low and the states to look at are particularly Kerala and Maharashtra, 44 and 58, which means that there's a very large vulnerable population still left. Now, on 6th of June, the joint statement of the Indian Public Health Association and the Indian Association for Preventive and Social Medicine called or urged the government to actually undertake district-level sero surveys, which the central government has now asked the state governments to do, which is nearly 6 weeks after we made this appeal. The time has come not just to shift from a One India plan to the states, but also to shift to a district-level plan. And finally, once the district-level sero surveys are known, the vaccination campaign will have to be tailored or customized to the needs of the district. Of course, this goes without saying that we need a stable supply and so on and so forth. I'm not even getting into that. But strategically speaking, we need a district-level strategy for vaccines. And finally, in a very recent commentary in The Lancet, 3 of the top scientists from the ICMR headquarters have actually urged for a district-level, well, if I may call, a blitzkrieg approach, where they want to, where they have recommended completely covering the district within a few weeks. The important thing there is to be able to do it without compromising on the equity aspects. Thank you.
All right. Dr. Paul, would you like to add to this here? As far as state governments handling district-wise in a more focused manner to ascertain their seroprevalence figures here, do you think that this is something that could help as well, as this is a recommendation coming in from the National COVID Task Force? Central teams have been rushed to Kerala as well to further ascertain ways on how to contain in the spread of the infection there.
Well, of course, the situation in Kerala is very serious when we go through the facts and figures. But we have to tackle it. As we all know, the coronavirus is a virus which is behaving in a very strange and unpredictable manner. The curve will go up one day and it will come down next day and it will be leveled the other day. But as I said earlier, we were fortunate, Kerala was fortunate last year in containing the spread of the disease, the pandemic. But this year, things, when
Right.
we examine the figures, it seems that it has gone beyond the control of the government. But that is not the situation here. One thing is that we are honest. We are honest to the core. There is no management or manipulation of figures. We admit what it is reported. But at the same time, people here are very restive. That is one problem which no government can ignore. The traders are on the warpath. All the other people, they all want to come out and engage in matters of their related to their livelihood. So, as I said earlier, life is important. Life is
Right.
precious. So also people's right to earn a livelihood also. That is why from triple lockdown,
No,
we
right.
are
And Dr.
experimenting
Paul,
with
I
so many
understand why
things.
you're saying this,
Then-
because the allegation on this recent spike against the Kerala government also is that you had allowed a certain opening up during Eid festivities, and now building up to Onam, of course, all eyes on what Kerala government is going to be deciding to do next year. Mr. Saravanan, would you be in agreement here in Kerala government trying to strike a balance, as Kerala has been saying that right from the start? They were transparent with their figures. They were also extremely scientific in terms of containment measures that had been taken in several instances, leading by example for the rest of the country here to follow. But there is always this this dichotomy of how to strike the balance. What is Tamil Nadu looking at in terms of striking the balance? Basis once again in understanding that you have already drawn out your own state seroprevalence figures there.
Yeah. See, with regard to Kerala, they earned their admiration from throughout the country, not only from throughout the country, apart also throughout the world, how they handled the first wave. And it was a model state. It was the way everybody wanted to handle this thing. But the figures, as rightly pointed out, they never fudged any data. They gave the data as such. And yet another important aspect in the Kerala model is the death figures are very low compared with any other thing. So that in that way I think it is a success. And when it comes to the state of Tamil Nadu, we have taken charge from May 2nd, and we have ensured that we should not go shopping for oxygen anymore. We have seen how the entire country was suffering due to lack of oxygen. So we drew contingency plans. We created a new post called Oxygen Commissioner, who will be in charge of the oxygen demand throughout the state if there is a third wave. And we are also having enough stock, almost around 1,000 metric tons of oxygen we are having. And we have ramped up almost the capacity, 80,000 beds are available. And whatever infrastructure we have created during the second wave, we are preserving them so that there won't be any mad scramble if there is a spike in the cases like what happened in the second wave. And yet another important thing is when we speak about this Sero survey, it gives a false sense of security. This is what a few of the experts, at least few now, are speaking, because you say 60%, 70% of antibodies. Then okay, fine, 70% of the people are having antibodies, so we don't have to worry about this virus spreading. So we have to really take this Sero survey report with a pinch of salt, is what we are saying. And whatever measures the Tamil Nadu government is taking, that is dehorse all these reports, all these things. We are determined, we are ready to prevent any eventuality.
Tamil Nadu has an under-reporting factor of at least 26 in that finding. So what is the Tamil Nadu government going to be doing about that?
Yeah, see, when we took charge, the first instruction the Chief Minister, Mr. M.K. Stalin, gave to the officials is, please report the actual figures. We are here to serve the people. Nobody is going to gain anything by fudging data, that was the instruction. And since we have come to power, we are always trying to give out all the relevant data, all the true data. And under our regime, the tests have also been increased exponentially. Huge number of tests were carried out. Since now there is a little increase in the COVID patients. Again, today from last few days, the test rate the PCR testing has gone up. So whatever has happened, we are talking about cumulatively what happened in the last 1 year when we were not in power. When we are in power, we are assuring that
Okay.
there won't be any fudging of data. All the real data would come
No,
out because
we
we
take your
know
word for
and we
testing.
believe.
Tamil Nadu is actually in the top 4 of maximum testing that are done on a daily basis here. Dr. Rajib Dasgupta, this is about how to positively use this data now, the zero prevalence percentage that we have, which establishes underreporting. What do we expect next from the central government? Should there be a word coming in from the central government here as an instruction to the states which have reported an average of 100 and above 100 underreported cases here? We haven't heard any of that stern message going out, that there is a sense that these other states are underreporting and they need to get their act together. Why aren't we worried about those states where it has already been established that they're underreporting?
Yes, just to clarify, just to reiterate for the viewer, the undercount is actually the opposite of underreporting. The undercount is comparing what has been detected actually through testing so far versus what the seropositivity rate means that the sum total of population have been infected. So undercount in the context of seroprevalence, a low undercount is actually good, and a high undercount means actually overall underreporting through these 1.5 years or so. So to that extent, Tamil Nadu, Kerala, since we're talking of these two states, fare actually very well. As far as testing goes for Kerala, I'm not so up to date with the Tamil Nadu figure. Kerala's rate in terms of per million population is 4 times the national average. And Kerala's case fatality rate is about 0.5 something, whereas the national is about 1.3 something. So even though the number of cases may seem alarming, Kerala has certainly managed to hold things at a certain level where mortality is low. And therefore, there are 2 or 3 things to worry or not to so much worry about. The first thing not to so much worry about is that given this favorable mortality rate and the fact that the health service is not overwhelmed in these 2 states at the moment is something we should be reasonably proud about or confident about at least. On the other hand, the fact that there are cases rising and would be more so in some of the districts compared to others, Kerala has about half a dozen districts which are reporting most of the cases. Those districts are important because this is the Delta variant, which the CDC said is as infectious as chickenpox, which simply means that what we call the secondary attack rate is very high. So if there are 10 members, let's say in a joint family, if a Delta variant is introduced into the family, at least 8 to 9 people will get that infection. This is compared to 2 to 3 of the parent strain. So that's the part we need to worry about. And finally, there is now that 1.5 years has gone, the global discourse has changed, and we simply haven't kept up with the discourse.
Yes.
Which is that states, particularly the highly endemic states, are now going to gradually reach what is called an endemic equilibrium. So you wouldn't see waves such as this, but we would actually see what is known as damped oscillation, which is what roughly, well, sorry for the pun, which is basically a rough sea when we see these kind of waves, but it will be like a more placid sea with little ripples and little waves rather than these huge waves. And that's called the endemic equilibrium. But depending on how much population movement is there, depending on how much...
Do you think that is what is happening in Kerala right now?
Just a second. Depending on how much the population movement is there, this endemic equilibrium will shift up a bit. But essentially, we are talking of damped oscillations. Now, Kerala, again, without a district level sero survey, it's a little difficult to comment. And this is something to be done at the district level. And the WHO is the WHO's 21st June guideline is very clear on this. There are 5 situational levels, 0 to 4, and each district has to take action based on how it is classifying it to the situational level. Sorry for taking a lot of time.
Right. All right. No, but we appreciate that despite the technicalities, we got the larger gist of it here, and also for our viewers to understand that at the end of the day here, as far as seroprevalence figures go here and a better understanding of containing in the infection here, this will now have to be done at the state level, at a very minute district level here to get the exact figures, and also help states that if there is an indication of under-reportage here on how to further add the thrust of what we call is targeted testing. Even if there are asymptomatic cases here, they need to be detected here to ascertain the real figures. Many thanks to everyone who's spoken to us here on this. We'll have to leave it at that.